Hey everybody, it's Dr. Wellwood here at the Natural Health Center and Regenerative Medicine Institute, and welcome to the clinic. So I thought I'd like to go ahead and start off a little bit of today's daily dose with a really cool study that I just read on the Journal of Ophthalmology in January 2018. And it's cool because it actually validates a lot of the things that I've been talking about over the last 10 years when a person gets in a whiplash trauma. So when I did my training in functional neurology with the Carrick Brain Institute, we were taught a lot about primitive reflexes of the eyes as well as balance. And that's something that has stuck with me throughout my period of time treating both chiropractic and medical patients, so my nursing practice as well as my chiropractic practice. And it occurs, I use this type of study here and information in order to help people who have these chronic pain due to whiplash as well as tension headaches. And what they found in this journal article is this study was conducted, and it showed that people who had suffered from whiplash trauma, so basically sprains and strains of the neck due to auto injuries or sports injuries, suffered three times as much headaches due to convergence insufficiency. So that's basically a big word that says the inability to track objects near to their face. So it's actually something that we test here quite a lot at my office using slow phase movements, and you can actually see the eyes bubble back and forth. And that's a really good indication that you've either had whiplash trauma or head trauma in the past. We treat it here chiropractically by using eye movements at the same time that we're actually doing the adjustments. And what that ends up doing is it actually resets the primitive reflex by activating the cerebellum, so the position sensor of the brain. So I've actually shown it on one of my videos, or actually a couple of my videos in the past on YouTube, and so it's something that you might actually want to go ahead and back and look at. And it's the actual videos where the person's moving their hands back and forth. And sometimes I refer to that as a brain adjustment. And I get a lot of comments for that, but it's a lot easier to say a brain adjustment than to actually go through the physiology of a person over and over again, particularly with other people who may not understand what it is that we're doing. That goes for patients as well as doctors, because we see a lot of doctors in the office here at both clinics, actually. So one of the other issues that we find that is associated with eye movements, and it's what's called the vestibular ocular reflex or the cervical ocular reflex. So cervical ocular reflex is the ability of the brain to control eye movements as we're moving our head, and that's one of the things that causes headaches as well. And if you have dizziness with that, it's called the vestibular ocular reflex. There's a whole bunch of other reflexes that I'm not going to go into today, but I thought it was really cool, and it definitely warranted a nice separate video for the daily dose because it is quite a significant finding. And if a lot of ophthalmologists and optometrists are also finding this, then and if you're a member of my website, then please send somebody to or you're a patient being affected to a local functional neurologist who is a specialty of chiropractic, or somebody who's actually trained in manipulation with those eye movements. So it's nice to be validated is what I'm saying. And you better believe I'm going to be talking to all my neurology friends, all the residents and all the physicians that I know in the area, which are always sending their patients to me anyway, because this is the type of thing that we're doing. So it's, again, Dr. Wellwood signing off for now, and yours of good health, and have a great weekend.